I think of from an employer side, they may be listening to this and saying, look, I don't want to be a healthcare company. I don't want to be talking with providers about what price we pay for claims. You talk about how difficult it is for employers to have these agreements. What type of work does it take on their side?
Yeah, so I mentioned at Risk Strategies, we moved to what's called an aggregator agreement, where we're actually coordinating that contracting process on behalf of the client to take all of that work off of their plate and to immediately provide access to other employers that want to engage with those existing agreements without as much work. And what we found with our healthcare partners also is it relieves a lot of administrative burden on their side of having to recontract every time. And so from the employer perspective, it's really not much different than the plan that they have today, because you still have a third-party administrator that's managing and running the plan on your behalf, and that piece doesn't change. And so it's really just another avenue for innovation within the health plan. And to Nick's earlier point, that's why a lot of our clients are engaging with it, because it's a pathway to not reduce the benefits and many times improve them, to incentivize members to go to those directly contracted providers while reducing costs. And there really aren't many options in the marketplace today that can achieve those two goals in unison.
So just to recap that, like, they are not setting up the network themselves. They're basically taking advantage of the network that we've created.
Yes, and we in our practice, we target it specific to each employer, and then every subsequent employer is just benefiting from the growth of that access, provider access points over time. And so from the employer perspective, they're typically not actively involved at all in that process, other than providing us the data to know where their members are going, so that we can go out and target those providers that their membership are using. And also we used all the national data, which is I'm sure Nick will have an opinion on the quality data that's out there. Nobody agrees on quality metrics in healthcare, but we use multiple national quality metrics in addition to the contracting, because it's not all about price. It's many times about health outcomes too. And I think that piece has gotten magnified as well because of COVID-19. Everybody's much more aware of the quality of the providers that they're going to, in addition to the access and the price.
You're finding that data, or you're taking that data of where the employees or members are going, maybe where they're located as well, and focusing on those providers to try to get them in network, but maybe putting even extra incentives in there for the high quality providers. Maybe they're, $0 copay, or you don't have to meet your deductible. Maybe there's no deductible or no out-of-pocket costs if they go to those high quality facilities, right?
Exactly.
And Nick, what do you have to add to that? And I know we've kind of gone off into a little tangent here, so I'll re-ask the question if you need me to.
No, I got it. And our strategy is very similar, very aligned with what Josh has described. We've built a network to be able to provide beyond adequate coverage across a broad geography, and to minimize disruption to an employer's team members. And we like to view ourselves for that network as the easy button for the employer. We handle all the negotiating and contracting with our participating providers exactly so that the employer doesn't have to. And that structure has given us the ability to scale and, again, partner beyond just Northwell to grow and meet the needs of an employer's particular footprint. Now, we will create transparency with our TPA partners around the data and the experience and the cost. And by the way, we're committed to a far greater degree of transparency than I think we've seen and a lot of these employers have seen from the traditional carriers. They often use a lack of transparency, in my view, to their strategic advantage versus the benefit of the employer. But where we do want to see partnership and engagement and investment of time from the employers is around the specific needs of their population, around the culture of their organization. Because what that allows us to do is to work with the providers that are participating in our network to customize care delivery programs to address those specific needs and to do it in a way that's culturally aligned with these employers. And that to me is a real differentiator. You're not getting that from the traditional BUCA carriers. They're not going to spend the time and invest the energy to say a primary care visit for your workforce should look like this and should have a heavy emphasis on these topics because that's what your employees need and that's what resonates with your culture. And we've had great success implementing those kinds of curated models, particularly in primary care with organizations like Whole Foods. And it's really resonated with them, the impact that we've been able to have sitting across the table together without an intermediary and recentering this based on the patient and the provider relationship.